Second lection, diseases of the nose and paranasal sinuses. Here you see the anatomy of the nose and sinuses. Nose have 5 functions. First, provide airway for respiration. Second, moisten warm air. Next, filter air, mucus and cilia, breath in through nose, out through mouth. Site of olfactory smell. And resonating chambers for sound waves. Hold your nose closed and see how you sound. Try, please. Difficult nasal respiration. Mouth opens constantly. Change in the configuration of skull. The skeleton of the face and head is lengthened. The upper jaw protrudes forward and the lower hangs. Hard palatin develops narrow and high. Violation of bite and normal teething. Here you see the mucociliary clearance. The work of clearance depends on viscosity of mucus, frequency beating of cilia. Ciliated cell has 50 to 100 cilia with a length of 5-8 microns each. The frequency of movements of cilia 10-15 strokes per minute. Movement speed of mucus 4-10 millimeters per second. Olfaction. Smells are capable to cause various reactions of the organisms, changed in the function of external breath, to influence the cardiovascular system, excitability of the muscles, nervous system, on activity of the brain, visual activity, influence mental condition of the person. Disturbance of smell. Hyposmia, anosmia, parasmia, cacosmia, respiratory and sensual. Disturbance of resonation. Open, maybe open, renal alea aperta, or closed, renal alea clausa. Curve of the nasal septum. No one has an ideal straight nasal septum, but it is necessary to correct it when the curvature disturbs the life, breathing, causes various diseases and complications. The most often reason for curve is trauma. The child in his childhood gets hit, the septum was deformed, and nasal breath disorder gradually progresses. If the trauma happens to the adult person, breath disorders can develop either right after trauma or gradually. Rhinitis. Rhinitis is a disease which is daily associated for an hour or more with at least 2 of the mentioned symptoms: nasal secretion, blocked nose, sneezing, nasal itch. Rhinitis is common for all age groups. It's considered the rhinitis most widespread disease on earth. Rhinitis, as a rule, has an infection origin, and it's always registered in cases of flu and acute respiratory viral infections. The children in before school age get sick with a viral infection of the upper respiratory pathways 6-12 times a year, while adults 2-3 times. The total amount of days that an average person is sick with rhinitis during his life makes up to 2 years. Chronic rhinitis is also widespread, with 10-20% of population suffering from it, and its symptoms being noticed during epidemiological researches in 40% of examined subjects. International classification of rhinitis. Infection rhinitis. Acute, chronic. Chronic may be specific and non-specific. Allergic may be seasonal or annual. Other rhinitis. idiopathic, professional, hormonal, drug-associated, caused by irritating substances, food, psychogenic and atrophic. Stage of acute rhinitis. First stage, irritation stage, dry sick, 4 up to 4 hours. Complaints, local non-specific feeling of dryness, thickening, pressure, headache, shiver. General, signs of the general infection syndrome. Objectively, hyperemia, swollen nasal mucosa, enlargement of nasal concha, narrowing of the nasal passage. Second stage, stage of serum secretion, 2 days. Complaints, bloated nose, tongue, headache, photophobia, running eyes, serous water allocation from a nose to 4-3, determinants of nasal wings, upper lip. Objectively, hypostasis, hyperemia of nasal concha, transparent discharge in nasal passage. Third stage of mucopurulent secretion, 3-5 days. Complaints, improvement of nasal breath, sense of smell, disappearing tongue, secretion become purulent, viscous, decrease in quantity, and there are crusts, sign of infectious syndrome gradually disappeared. Objectively, hyperemia, hypostasis of the nasal mucosa decreases, dry crusts, dense slime, nasal passage delayed, nasal breathing and olfaction are restored. Features of acute rhinitis in children. Proceeds as severe general infection disease. Spasms, panhyperthermia. Spells, opistatonus. Feeling disorders. The child does not eat up, does not gain weight. It's also accompanied by dyspepsia, vomiting, meteorism. Pulmonary breath. Restriction of excursion of lungs is distorted. More often laryngitis, bronchitis, pneumonia. More often otitis. Locally proceed as rhinopharyngitis. On a soft palate, red dots, inflamed mucous glands. On the rear wall of the pharynx, purulent excretion from the nasopharynx. On rear wall of pharynx, hyperplasia of lymphoid follicles. Treatment of acute rhinitis depends on age, stage, etiology, professional conditions. Bed regime for children in case of intoxication. Fresh air in case of bad walking conditions, a sick leaf. Sweat producing hot bath for feet, hot tea, plentiful drinking. In the early stage, aspirin and paracetamol. Locally, vasoconstrictive drugs in the case of need or in case of development complications, such as sinusitis and otitis, no more than 3-4 days. System decongestants, drugs containing pseudoephedrine and phenylephrine, Actifed, Sudafed, Trifed, Effect, Sinus, Zestra, and so on. Physio procedures. Laser therapy, ultraviolet, antiviral drugs, lafirone, referone, Poludal in case of viral, and so on. Allergic rhinitis. It's a global medical social problem. Widespread all around the world, 10-25% of total population are exposed. Causes significant influence on quality of life, study process, and labor productivity. Treatment is expensive, may cause bronchial asthma. Classification of allergic rhinitis may be seasonal, intermittent, pollen or mycotic, and year-round or annual, persistent, household, epidermal, food. May be light, normal sleep, normal activity through the day, during sports or leisure time, normal working capacity, absence of disturbing symptoms, and middle severe, one of several signs, sleep disorders, Disorders of normal activity through the day, during sports or leisure time. Decrease in working capacity. Disturbing symptoms. Here you see the clinical manifestation of seasonal allergic rhinoconjunctivitis. Allergen-specific diagnostics. Skin tests are usually carried out in form of a prick tests. Specific different immunoglobulins E, specific revealing methods, immunoferment, radioallergen, and so forth. Immunothermistometry, etc. Combined therapy includes full or partial elimination therapy, irrigation of the nasal cavity with different solutions, antihistaminic medicines, topic glucocorticosteroids, and specific immunotherapy. Here you see the X-ray projections of paranasal sinuses, frontal sinuses, ethmoid sinuses, maxillary sinuses, sphenoid sinuses. Classification of sinusitis. Manifestation: acute up to 1 month, subacute from 1 up to 6 months, and chronic more than 6 months. Localization: monosinusitis, maxillary sinusitis, ethmoiditis, frontitis, sphenoiditis. Hemisinusitis: all sinusitis are involved on one side. Polysinusitis: 2 or more sinuses are involved. Pansinusitis: all paranasal sinuses are involved. Occurrence may be primary and secondary. Infection spread: rhinogenic, odontogenic, traumatic, and hematogenic. Morphologic classification of sinusitis: acute, viral, post-viral, purulent. Chronic: polyps and purulent without polyps. Symptoms of sinusitis: general infection symptoms and local. Complaints: rhinitic symptoms plus nasal secretions, pain in sinus, swell of face, eyelids. Examination: swell, filtration of the soft tissue of face. Palpation: pain when palpating the walls of sinuses. Rhinoscopy: rhinitis symptoms look above. Line of path depends on localization. Reactive inflammatory changes in pharynx. Odontogenic sinusitis. Here you see picture with involved teeth. Features of sinusitis. Here you see the left side maxillary ethmoidal sinusitis in the picture. Ethmoiditis. In most cases, accompanies other sinusitis. Pain localized in the region of a root of a nose and an orbit. Swelling of a medial corner of an orbit. Pus strip in the middle and superior nasal meatus. Feature of sinusitis next. Here you see the right side frontitis. Frontitis. Pain stronger than narrow frontal nasal channel, is localized in a projection of a sinus with irradiation in temple. Amplifies in the afternoon when the patient ducks involves pulsation. Often running eyes and photophobia, swelling and upper eyelid. Pus strip in the middle nasal meatus. Feature of sinusitis continue. Here you see the left side sphenoiditis and near the normal sphenoid sinus. Sphenoiditis in most cases accompanied myoiditis. Pain strong in occipital region behind an eye with sensation of a pressure. Pus strip in the superior nasal meatus and nasopharynx. Additional analysis in sinusitis. X-ray of paranasal sinuses, diagnostic puncture of a sinus, microendoscopy of nose and sinuses, CT, MRI, endoscopic sinuscopy, histologic research, tumor, distance infrared thermography, cytological research, in case of tumor also, and diaphanoscopy. Treatment of sinusitis depends on presence of complications, functions of connecting points, sinusitis state, acute or chronic, character of process, purulent, catarrhal, localization of process, maxillary sinusitis, sinusitis. In the presence of intracranial or orbital complications, a radical operation on sinus with elimination of purulent focus and formation of new connection with the nose cavity is always carried out. In case of a premature functional disturbance, in chronic sinusitis, operative treatment, elimination of the inflammation and restoration of the connection. In case of acute sinusitis, drainage of the maxillary sinus, trepanal function of a frontal sinus. Medicament treatment of sinusitis. Endonasal applications. Vasoconstrictive drops, naphthizine, xylometazoline, so on. Antibacterial drugs, Isofra, Polydextra, and so on. Non-specific anti-inflammative drugs, Biclotimol, and so on. Antibacterial drugs, antibiotics. Non-specific anti-inflammative drugs, aspirin, diclofenac natrium, tamizone. Desensibilizing drugs, loratadine, claritine, levocetirizine, and so on. Systems and pulmonomimetics, pseudoephedrine. Introduction in sinuses after irrigation by antiseptics, antimicrobic preparations, corticosteroids, and enzymes. Additional method of examination of patients with sinusitis. Here you see the video endoscopy of the sinus. Chronic polypoid sinusitis. Surgical treatment. Here, operation on the maxillary sinus. Endonasal endoscopic surgery. You see in this picture how to do.